Welcome to this video review on psychoanalysis. So psychoanalysis was the first form of psychotherapy, and when we think about this therapy, we need to think about Sigmund Freud. He came about during the Victorian era in the early 20th century. Right at the turn of the century, this is when he published his book, The Analysis of Dreams. You might recall learning about dreams earlier in the textbook earlier this semester, and you learned about dream analysis. And Freud was interested in hearing what his patients had dreamt about. And what he would do is he would interpret these dreams, and he had identified what he called the manifest and latent content. So the manifest content was what the dreamer recalls, and the latent content is the underlying symbolic meaning of that dream. And that was an important part of psychoanalysis for Freud. And what Freud was wanting to do is he wanted to uncover repressed feelings that were housed in the unconscious. So dream analysis was one of those techniques. Another technique is free association. If you look in your textbook, you'll see an image of a Freudian couch or sofa. Interestingly, these became very popular around the time that Freud was doing psychoanalysis, and there was a podcast you can listen to if you just do a search on podcasts. And I can't remember exactly how I found it, but you can do a search for Freudian couch, and it's a brief podcast where they'll describe the company in New York that developed these sofas and made a fortune in coming up with exactly the right sofa for therapy. It reminds me of the story of Goldilocks, where the bed the bed for Goldilocks at one point was too hard, then it was too soft, and then she found the one that was just right. So for Freud, the sofa needed to be just right, not too soft, not too hard. It needed to be the right size. And this was because, of course, you didn't want your patient to fall asleep while they were on the sofa, but you wanted them to be very relaxed. And Freud would have his patient face away from him, and he would ask them to free associate. In other words, to relax and then just say whatever came to mind at the moment. And what Freud thought was that the ego would try to block unacceptable urges or painful conflicts during free association, and then this would cause the patient to demonstrate what he called resistance. And resistance is where a patient would change the subject. This would be a very interesting pivot, because right at that moment, as a patient's changing the subject, this then would be an indicator that right at that point, prior to that there was something that the patient was getting to, that maybe your ego or that patient's ego was trying to prevent from reaching the surface. Also, Freud was he was also interested in another aspect of resistance, which would be when a patient would miss appointments. He thought that that was meaningful. For Freud, there were no mistakes. Nothing was accidental. Everything was meaningful. And in each of these behaviors, changing the subject, missing appointments, each of these deserved time and focus. And in addition, he was interested in how patients interacted with him. And what he was doing is he was analyzing what he called transference. And this was where the patient transferred their knowledge. Sorry, not their knowledge. My daughter was talking in the background, got me a little bit distracted. But they're transferring their feelings and their behaviors onto their therapist. So let's imagine, for example, that you were to seek therapy and you were seeing a male psychotherapist or psychoanalyst. And as you are interacting with that male, that psychologist notes that you are very much a pleaser, that you just want to say whatever you think the psychologist wants you to say. And perhaps then, again, there are no accidents, everything has meaning and importance. Perhaps then this may be an indicator of how you interact with a significant male in your life, what that dynamic may be like for you. Psychoanalysis today is different. I should point out that historically, when Freud was doing psychoanalysis, he would see his patients, which were primarily wealthy women, many times per week and over the course of many years. Today, insurance companies won't typically pay for this. Some insurance won't pay for more than 2 sessions a month. Some will pay once a week, but this then affects the way that therapy is done. And it affects, it had an effect on psychoanalysis. So we see that today psychoanalysis is less popular, but that when people do go to see a psychoanalyst, it's much briefer, and it is a talk therapy that is based on the belief that the unconscious and childhood conflicts impact behavior. As many of you will remember from earlier in the semester, Freud was focused on sex and aggression. He thought that those were very important impulses, significant impulses that rested within our unconscious and directed much of what we did. And that then, just like you learned about in the chapter on consciousness, that these impulses may come out in the form of dreams, in the form of phallic or symbolic symbols. But today, the contrast is that modern psychodynamic therapists are not focusing on sex and aggression, but instead on childhood conflicts, how these early childhood experiences that we have may be repressed in the unconscious and affecting who we are today. You can see here in this image that this is the famous couch in Freud's consulting room, and patients were instructed to lie comfortably on the sofa, and they were then asked to face away from Freud. And the idea was that they would feel less inhibited, and this would help them to be focused. So today, a psychotherapy patient is not likely to lie on a couch. Instead, they're more likely to sit facing the therapist. For more videos like this one, visit the YouTube channel Psychology Lab.